Hematology updates covering the latest breakthroughs, brought to you by Lucid Quest. CellCentric completed enrollment of 60 patients in its Phase 2 dose optimization trial of Inobrodib with pomalidomide and dexamethasone for multiple myeloma. Earlier cohorts showed a 75% overall response rate at the highest dose. Data expected in late 2025 may guide prescriber and payer decisions. Johnson & Johnson's Phase 2 MajesTEC-5 trial reported 100% overall response and MRD negativity in transplant-eligible newly diagnosed multiple myeloma. Among 49 patients, 85.7% reached complete response or better after induction with Tecvayli plus Darzalex Faspro. Cytokine release syndrome was mostly grade 1 or 2. These results could influence treatment and reimbursement. Moleculin dosed the first European patient in its pivotal miracle trial of Annamycin with cytarabine for relapsed or refractory acute myeloid leukemia. The adaptive Phase 2b and 3 study will unblind 45 patients in the second half of 2025. Findings may affect prescribing and payer reviews. Akeso received FDA orphan drug designation for ligufalimab, a CD47 antibody in AML. The drug is also in Phase 2 AML and MDS studies, with Phase 3 testing in solid tumors. The designation highlights its potential role and raises competitive pressure in AML. Syndax's Revumenib was added to NCCN Guidelines as a Category 2, a recommendation for relapsed or refractory NPM1 mutated AML. The listing follows data from the pivotal Augment 101 trial. A supplemental new drug application is under priority review with a PDUFA date of October 25, 2025. The update may influence practice and access. Lilly's Jaypirca, or Pirtobrutinib, showed a progression-free survival benefit over chemoimmunotherapy in untreated chronic lymphocytic leukemia and small lymphocytic lymphoma in the Phase 3 Bruin CLL 313 trial. Among 282 randomized patients, overall survival trends positive but is not yet mature. Results may affect future guidelines and reimbursement. In early development, Bexobrutideg, a BTK degrader, showed strong activity in heavily pre-treated relapsed or refractory CLL. The Phase 1a trial in 48 patients reported an 81% overall response rate, with durable responses beyond 2.5 years. No dose-limiting toxicities were observed. These data could shape future strategies. Roche announced CHMP backing for European approval of subcutaneous Lunsumio in relapsed or refractory follicular lymphoma after at least 2 prior therapies. The Phase 2 GO29781 trial showed non-inferior pharmacokinetics versus intravenous dosing, with a complete response rate near 59% and durable outcomes. Approval may impact pricing and formulary placement. Stay ahead in hematology research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next